This video was supported by the Australian Government through its Wildlife Rescue and Rehabilitation Initiative and the Foundation for National Parks and Wildlife. Hi, I'm Dr. Bree Talbot, Foundation Vet for the Byron Bay Wildlife Hospital, and today assisting me we have Vet Nurse Kat, and we're going to be showing you how to look after a flying fox in your vet practice. Now, most flying foxes when they come in are going to be inside a cage like this. Hopefully the carer would have brought in a sign saying that it's a live bat so that all your staff members know that you have a live animal in this cage. It's important to remember only to handle flying foxes when you're fully vaccinated. Before getting your flying fox out to examine it, remember to get all your PPE ready. Depending on the risk assessment and the clinical signs that your flying fox is exhibiting, you may require wearing eye protection and a face mask. But the basic PPE that you should have on every time is a long sleeve top, nitrile gloves, and then cut resistant gloves as well. If you don't have a long sleeve top on, something like welding gloves that come up to your forearm or neoprene arm gloves can help as well, because we want to minimize the potential scratches that could occur when you've got a stressed flying fox in your practice. The easiest way to get the flying fox out of a cage like this is to use a nice thick towel. Now Kat's going to demonstrate how to get the flying fox out of the cage for us. She's going to gently approach the flying fox, open the cage, and what we want to do is use our towel and actually encircle the bat with its wings closed so that it feels nice and comfortable. Once she has the towel around the body of the flying fox, she's going to unclasp the claws from the cage. You just want to take your time and be calm with them. You may need to help them get the claws out from the cage. So once you've got your flying fox out, you want to make sure that you keep all the body wrapped up in the towel and we examine one part at a time. Make sure that you have control of the head so that it can't bite you, but also to allow them to look around if they want to. Some bats do prefer to have their heads closed in the towel, and that will just come with experience learning which bat likes what. So while our bat is conscious, when you're handling them and examining them, please wear your thick gloves to prevent any scratches or bites. And what you want to try and do is examine one part at a time and check the wings, check the body, your normal physical exam technique. Okay, so with our flying fox, we want to make sure that we're checking their eyes. We want to see if there's any corneal ulcers. We want to check their nose to see if there's any scratches or any discharge. We want to check ears for any ectoparasites, so ticks, mites, anything like that. And you also want to check the oral cavity. A lot of flying foxes that are caught on barbed wire will actually get a lot of trauma to their teeth and their hard palate. You may require general anaesthesia for this, which we'll show you in a moment. What we want to do is we want to gently extend the wing. We want to look at the membrane. We want to see if there's any trauma, any parasites, any infections, and you also want to check the range of mobility in that forearm. You can see that we have lots of vessels coming along this membrane, and often that these can get injuries to them, and you want to check to make sure that there's no compromise to the vasculature there. We're going to do this on both sides as well. We want to check for warmth of the wing too, and this is also very important of the feet. Sometimes they can get injuries that will change the blood flow to the feet, and we want to make sure everything's nice and warm. If possible, the easiest way to do the rest of your physical exam is under general anaesthesia, and we'll show you that now. To anaesthetise a flying fox, using a mask induction is going to be your easiest technique. Place the mask over the nose, allow them to breathe in some fresh oxygen for a while before we then turn on the anaesthetic gas. With some flying foxes, you may find doing a gradual increase in the isoflurane will be easier and more calming on them, but there are some bats where a crash induction of 5% will actually decrease the stress and get them under anaesthetic quicker. While your bat is being anaesthetised, this is a good time for your nurse to monitor the breathing, monitor the heart rate, and just actually have a general look over until the flying fox is actually fully anaesthetised. Do not uncover your bat fully until you're happy that it is anaesthetised, otherwise you may have a flying fox that is flying around the vet clinic. So once your flying fox is anaesthetised, this will now give you an opportunity to do a thorough physical exam. We want to have a look at each side of the body. We want to look for symmetry, we want to look for injuries, or your common things that you're going to be looking for with flying foxes. But the most common reason they're going to be coming into care is because of barbed wire entanglement. The wing membrane is going to be the area that gets affected the most, and it's really important that you have a good look at both wings to make sure that there are no wounds, no injuries, and no pieces of barbed wire stuck in there. Checking the feet, making sure they're okay. You can see that we have a pulse ox on this foot, and this is helping us monitor the anaesthetic. Check the fur, check the genitals, make sure they're nice and clean. Often flying foxes that have been stuck on barbed wire for a number of days can actually have maggot infestation, so you want to check all the orifices to make sure that there are no little eggs or larvae appearing. Be very careful when doing this, but you want to gently open the mouth and have a look at the integrity of the hard palate, soft palate and teeth, especially if there has been barbed wire involvement. So now what we're going to show you is the injection points for giving fluids, taking blood and euthanasia. With your venipuncture access points, we have our external jugular vein, which is in the same position as your dogs and cats, and you'll just need to clip that area. We also have our cephalic vein, which runs along the leading edge of the membrane. We have our medial vein, which runs along the medial aspect of the humerus, and we have our uropatagial vein, which runs on the inside of the leg between the two legs. These are our easiest spots to take bloods in flying foxes. The other thing that you can give flying foxes is subcutaneous fluids, and the two most common places that we can give this into flying foxes is on the back, so where we would give it in dogs and cats, or you can give it on their abdomen in the lower region where we've got some nice sort of excess skin there. It can be a little bit uncomfortable for flying foxes to receive it there, but if they do have injuries on their back, this might be your only place to give it. We're going to be giving fluids to our flying fox here, Brandy. Remember to always have them warmed up to body temperature before giving it to them. Okay, lift up our skin, make our tent, pull back. It is quite easy to go through the other end in flying foxes, and then you should get a nice little bubble. Placing your flying fox in position for x-rays. Now this is going to be one of the most common things that you do with flying foxes, especially if they have been caught in barbed wire or they have been found low to the ground. We want to rule out any fractures and assess the integrity of the skeleton. We've placed Brandy in her VD position for her x-ray. You can see that we've used minimal tape on all points, but we want to make sure that the flying fox is symmetrical, and we've used micropore tape because it's quite gentle on their skin and gentle on their membrane. So we've got our mask on, we've got our flying fox in the middle, and we're nice and straight and we can take our x-ray. Once we've taken our VD, we are now going to position the flying fox in the lateral position. It is easiest to do it actually with the wings down, and you want to make sure that we still keep the spine nice and straight. We can see the position of the tape to keep everything in place for our view. Every flying fox animal that comes into your practice should be weighed. The easiest way we find is to get some kitchen scales and get a clipboard or some kind of structure that is nice and flat to weigh your flying fox in. So once you've done everything with your flying fox, you can now wake her up from anaesthesia. It's best to use a towel and wrap the bat in like a burrito style so that they're not too stressed, but they can still breathe and you can still monitor their respiration if needed. Nurse Cat has actually placed the feet at the bottom so she can hold the feet when she wakes up, but we can actually wrap the bat around the towel to keep her comfortable. To place your flying fox back into its cage, there are two ways you can go about this, and this will depend on the flying fox's demeanour and injuries. The first way you can place them back in is to allow them to hang, and that will be putting the cage back on its long side, putting the bat back in and allowing its feet to grasp on the top of the cage. Otherwise, you can place the bat back into the cage in its burrito and allow it to get out within time and when it's feeling right. So today we're going to get Cat to show you how to place it back in as a burrito. So nice and calm, head down. The burrito is loose so that she doesn't struggle too much when she wants to get out, but she still feels secure within there if she's not feeling great. And then you can see Cat is also placing her feet at the end to hang on if she wants to. She might not, but so she knows where the cage is if she does want to get out. Once you're happy that she's comfortable, close your cage and then place your towels back over the top. And this is to minimize stress, but also to show your staff that you do have a flying fox in there, because you're still going to have your sign on there. We are very grateful to the Foundation for National Parks and Wildlife for producing this video. If you have any questions regarding treating our Australian native animals, please do not hesitate to contact the Byron Bay Wildlife Hospital at www.byronbaywildlifehospital.org.